Friends and residents of Choa Chu Kang, Kehong, Bukit Gombak, and Nanyang, good evening to all of you. Welcome to our rally. First, let me thank all of you for your support over the last 5 years for my team and I, so that we can serve you in this place, so that we can contribute and we can work with you. I want to thank you for the opportunity they have given to us and your support. Thank you very much. Friends, your friends first, residents second, because I know many of you, and many of you know me. Friends, this year is a very important year. We celebrate SG50 this year. We have done well over the last 5 decades. When we became an independent country in 1965, the future then was uncertain. As the late Mr. Lee Kuan Yew put it, it was a moment of anguish. Many thought we would not make it, but we did. Now, 50 years later, we have turned a moment of anguish into a moment of pride. We created a robust economy. We developed a world-class education system. We built flats to house the nation. We evolved an outstanding healthcare system to keep our people healthy. But the landscape is changing. Our demographics are evolving. Family structures are changing too. Our society is also developing. We need to constantly adjust our policies in response to these changes. Indeed, the PAP government has made several significant policy shifts over the years. We have stepped up the housing program to ensure that we have sufficient flats while keeping them affordable. We have established new universities, introduced Skills Future to provide more opportunities for Singaporeans to pursue further education and skills upgrading. When it comes to jobs, we have further tightened the inflow of foreign labor, calibrating carefully to avoid stifling our local businesses while creating a Singaporean core. We have also enhanced our social safety nets to nurture a more compassionate and inclusive society and ensure that no one is left behind. Now let me talk more about healthcare, which is a subject very close to my heart. We introduced Healthcare 2020 Master Plan to build capacity, ensure quality, and improve affordability. The integrated building at Changi and Ng Teng Fong General Hospital, which opened in July, have added more hospital capacity. Jurong Community Hospital has also opened, and Yishun Community Hospital will also open shortly. We are also building nursing homes as well as developing polyclinics. We will be transforming the Outram campus over the next 20 years to meet the future healthcare needs of Singaporeans. These are very long-term projects that require long-term planning and careful implementation. We are evolving our healthcare system even as we expand it to take care of the older population today and going forward. We are investing in training and capability development so that our healthcare professionals can better prepare for the aging population. We are also recruiting more healthcare professionals, especially our nurses. Let me take this opportunity to thank all our healthcare workers and professionals for their dedication and their hard work. Thank you. We are investing in keeping our population healthy throughout their life cycle. These are also long-term policies that will span 10 to 15 years to implement and require significant resources. Let me ask you, which party do you think can implement all these policies? Which party do you trust with the money and the resources to implement these policies? Yes. And let me assure you that healthcare costs will always remain a concern, not only to the Ministry of Health, but also to the Minister of Health and to the Prime Minister as well. First, we want to keep hospitalization costs affordable. We will introduce a MediShield Life in November this year. It will provide all Singaporeans with better protection and for life. MediShield Life will pay out more so that patients will pay less. You don't have to worry about premiums, as the government will provide premium subsidies for the middle and lower income households. This way, we keep MediShield Life affordable and hospitalization also affordable. Many residents, especially our seniors, welcome the scheme. Guess what? Which party made it happen? Next, we want to also help Singaporeans with outpatient costs. We expanded the CHAR scheme to cover the middle income group so that they too can enjoy government subsidies even when they visit a private clinic. To date, 1.3 million Singaporeans are on CHARs. We have also enhanced specialist outpatient clinic subsidies. I want to talk more about our pioneers now. They serve our nation, and it is important for us that we recognize them and their dedication to Singapore. So we introduced a Pioneer Generation Package to honor 450,000 pioneers among us who built Singapore to what it is today. The Pioneer Generation Package offers special subsidies and special Medisave top-up, as well as outpatient subsidies for our patients, for our pioneers. This Pioneer Generation Package doesn't just ease the burden of our pioneers. It also eases the burden on their children, on you, our residents, who are their caregivers. In fact, Pioneer Generation Package is not just about healthcare costs. Pioneer Generation Package is about recognizing and honoring our pioneers. So to our pioneers, thank you very much. We can only do this because we have been careful in our finances over the years. Can you count on any other party to be so careful? No! Let me talk about our collective vision as a nation. As we celebrate Singapore's past achievements, we must also think about our future. What kind of Singapore do we want? What kind of society do we wish to have? What kind of values do we want our children to have? What kind of politics do we want to have? This election is very important because it is where we will be choosing our next generation of leaders. These leaders will chart the direction of Singapore's development and lead us forward into the next 5 years, 10 years, 50 years. We have come so far because of exceptional leaders like our founding Prime Minister, Mr. Lee Kuan Yew, and his team, who were able to succeed against all odds, working with Singaporeans. They were exceptional in 3 important ways. First, they were exceptionally visionary in many of their plans. Second, they were exceptionally determined and brave in overcoming obstacles and challenges. Third, they were exceptionally dedicated. They gave their lives so that others may have a better life. The challenges we face ahead will be quite different from those of theirs. But we need the same qualities in our current and future leaders to take us forward towards SG100. Without vision, without determination, or without dedication, we will not make progress, and we will be marginalized over time. So we need to choose our leaders very carefully. I will conclude my speech by talking about Choa Chu Kang and our vision for it. What do we hope Choa Chu Kang will be like in 5 to 10 years' time? We want it to be a better home for you, the residents, and we want to continue to work with you to make that happen. Chia Sing talked about making Choa Chu Kang a better home in a vibrant community. Zaki talked about making Choa Chu Kang a better home for today and tomorrow. Yan Ling talked about making Choa Chu Kang a better home for your family and your children. I will talk about making Choa Chu Kang a better home for all ages. All of us are aging quickly, getting older. Singapore as a whole is getting older. We can remain vibrant, connected, active, and we can lead a fulfilling life even as we age if we do it right. There are 3 things we must do. First, we have to ensure that our infrastructure and facilities are age-friendly. That means they're suitable for the young, the grown-ups, and the old. We have put in place lift upgrading programs, which Mr. Zaki talked about. We have fought hard for neighborhood renewal programs, as well as home improvement programs that included programs such as EASE. Secondly, we need to create opportunities through activities and programs for intergenerational interaction, so that the old remain part of the family and part of the community. That is why we do our best to foster intergenerational bonding. We do this by having more green spaces and programs where all members of the family can come together to meet with their neighbors and to strengthen their family bonding. Many of these programs are designed to bring the community closer. And our Care and Share initiatives has also benefited many residents. Why do we do this? This is because we care for you. And this is why we also want to help and encourage our seniors to stay healthy, so that they not only live long, they can also live healthily and live well. There are plans to create more spaces and more senior fitness corners around Choa Chu Kang, so that our older citizens have ample opportunities to keep fit and stay fit, as well as to mingle and make new friends. We are also conducting health screening programs for our seniors to better diagnose and manage their chronic conditions. These are exciting plans we are putting together, but we cannot do it alone. We welcome your ideas. We need your participation. So do please give us your contribution and your feedback. But most of all, we need your support and your endorsement. Today on this stage, my team and I will renew our commitment to serving the residents of Choa Chu Kang. So I urge you to give my PAP team a strong mandate so that we can work with you, and for Singapore. Vote PAP for a better home. Majulah PAP. Majulah Choa Chu Kang. Majulah Singapore. Thank you.